Have you ever wondered how you can actually naturally fix your poor posture pain that you're feeling in your neck? As a medical massage therapist, that's a lot of the times when my clients are experiencing their pain, they just say, this is where I hold my tension. I just hold my tension from work in my shoulders. And really what's actually happening is that these trap muscles and the muscles in the neck are being activated because of your breath. And so today in this video, we are going to break down why that's happening, how your breathing is actually perpetuating your poor posture problems, and also how you can actually fix your posture with your breath. And so I'll preface all of that by saying, and we're just gonna get right into it, right? That breathing is actually your body's natural posture regulator. And so when it comes down to it, you have your spine, and your spine is avascular, which basically all that means is that it's not innervated by blood, and how it gets its nutrition is through movement. And so proper movement, specifically compression and decompression. So every time you walk, every time you move, your spine is shifting, it's compressing, it's decompressing, fighting the gravity and all the forces that are coming against it. And so what breathing does is you have your diaphragm, and as your diaphragm expands and contracts, it's actually allowing for proper compression and decompression of your joints, specifically your spine. And so look at it, your diaphragm is actually part of this huge fascial web that runs deep into your body. So you're gonna have the deep front line, which is gonna attach on this bottom medial aspect of the foot. It's gonna come up the deep middle of our calf. It's gonna insert into these adductors, adductor fascia on the inside of our leg, all the way up into our iliacus, into our hips. So if you have a lot of inside hip tension, if you have a lot of compression in the hip, your diaphragm is gonna be connected to all of this, because it's gonna come up the psoas, into the diaphragm, into these intercostal vertebrae on the anterior aspect inside of your body, all the way up into the scalenes, hyoid muscles in the neck, all the way up into the sides of the head. And this deep fascial line is pulling, it's adding a level of tension to your entire body. So the first step to fixing your poor posture pain is to be solving for the breath. And so that is not just any kind of breathing, it's deep diaphragmatic breathing. And so you've seen this over the years. You want to put your hand on your chest, notice the breath. Is the chest rising? Is your ribs expanding? One hand on the chest, one hand on the rib. If your chest is rising more than the ribs, you want to expand the ribs. They're going to come out. Chest will rise on the first time. Keep the ribs engaged. Deep breath, and every time you take a deep breath, you want to feel the ribs expand, the chest relax. Ribs expand, and the chest relax. On the exhale, now what you're going to do is you're going to put your hand on your belly button, one hand on the rib, take a deep breath, and you're going to exhale out, pulling your belly button towards your spine. What you should actually feel is your hips shifting back and your glutes contracting. Now we're going to activate this whole entire chain while we're sitting down. And so the first thing you want to do, again, put your hand on your chest, notice your breath, then put your hand on your rib, let your ribs expand, then put your hand on the other rib. That way you can really feel it, because if you're not feeling it, what you can actually do is give your body a little feedback. So compress the ribs a little bit, and you'll be able to feel them expand when you take your deep breath. Exhale, pull the belly button towards the spine. And you want to do this for about 5 breaths. And then the next thing you want to do is, after you can do this normally, you put your hands on the inside portion of your knee, and you're going to give yourself some feedback again. So you're going to pull your knees in, and now you're going to start taking those deep breaths. You should feel your glutes start to engage, your back start to engage. Deep breath. Exhale, give yourself that feedback. And as you give yourself that feedback, what you should actually be feeling is your feet pressing down into the ground. If that doesn't happen automatically, you can do that consciously, but you just want to make sure you're pushing that big toe down into the ground. And the thing about the big toe is that in order for your glutes to get maximal activation, right? A lot of times we have weak glutes or glutes that are inactive because of our poor posture or a tilt in our pelvis. Your big toe needs to be in alignment or directly straight ahead in alignment with your knee. So sometimes our toes can deviate because we've been putting them in shoes for a very long time. And so our feet have formulated to the same shape as the shoe. And so what you want to do, if that's the case, is you're going to look at your feet. You're going to take your big toe, pull it over into the midline or pull it straight ahead, and you'll see it. You don't want to overstretch it, but you're going to pull it straight midline, right? It's going to be right in the middle of your knees. So your fingers are going to be providing feedback for your toes, and you're going to push that big toe down into the ground. And what you should actually feel is a contraction on the inside of your feet. And this is your arch. So a lot of people don't actually have flat feet. What they have are weak arches. And that's typically because our feet have just been trained into shoes, or we haven't been barefoot long enough to train those arches. Or it could be a pattern that we learned from our parents or somebody who was watching us. And so you want to provide that feedback, push that big toe into the ground, heels planted, give yourself that feedback in the adductors, exhaling. And you want to do that for about at least 10 breaths. You want to do that inhale, exhale, stabilizing the spine. And as you get up, you should just feel your entire body stronger. You should feel a deeper connection with your adductors, your calves. Now, if any one of those areas cramped, that means you need to be set up more for the release portion. And so we're going to get into that. And so we talked about breathing and how it correlates anatomically, but I wanted to make sure I touched on these specific points and just make sure I got to them, because breathing has a relationship with stress. And so when you talk about stress management and we talk about this poor position, a lot of times when I'm talking to my clients, what I'll find is they'll have a stress response. Maybe it's work, maybe it's at home, it's the kids, it's just so much stuff that you have to do. And then also it's these same similar muscles. It's always in the neck, it's always in the chest, right? You're feeling this tension across your chest, you're feeling it in the neck, you're man, or it's coming up into your head, right? Because you're having headaches. So these muscles in the neck and in the chest are your secondary respiratory muscles to breathing. And so when we're not utilizing our diaphragm correctly, right, because it's compressed, maybe because we've just turned it off because it's not efficient for the posture that we're in. And so what happens when these muscles turn on, they're also sympathetic dominant muscles, because that faster breathing, right, these secondary muscles to breathing are also attached to when you're in a stress response. And so now when you're stressed, you're utilizing these secondary muscles, and then if they don't turn off, you stay in a sympathetic dominant fight or flight state all day, maybe for a couple of days, maybe for a couple of months, right? And you're wondering, why do I have this tension? It feels like more tension is on you now, right? Because you're starting to breathe through these secondary respiratory muscles to breathing. And if it gets really bad, then you start breathing through the mouth instead of breathing through your nose. And then that's when your immune function starts to go down, because you have obviously your nostrils protect you. It's one of your first layers of protection against pathogens. And so when you're in this sympathetic dominant state and your gut is starting to feel stressed, it's also because when your diaphragm as a function, as it begins to expand and contract, it pushes down against your stomach, which also helps to relax it. And so when you're not in this relaxed state with your breathing, your gut is not prepared because it's not producing the same level of stomach acid, because your diaphragm isn't properly compressing it. It's not regulating it like it should. And so your diaphragm is a natural gut relaxer. It's a natural gut restorer, right? And we're not even talking about the oxygen benefits, because there's some studies that say, oh, you're not actually getting in more oxygen. But I question sometimes how these studies are run, but they're not saying that you're getting in more oxygen when you breathe diaphragmatically. But I'm arguing that you're taking in a better quality of air because you're using your diaphragm. You're working with how your body already functions, and then you're not working against your body and forcing it to do more by utilizing these secondary functions, which puts more stress on your body. The chronic little stressors over time is what gets us. And so by unraveling those little stressors, you're making your body automatically stronger. And so the third thing I wanted to get into a little bit more is that how this tension, when it starts to couple in your body, it starts to crawl up into your neck, into your head, right? To cause these TMJ like symptoms, to cause these cranial pressure like symptoms because of the fascia and how it stretches up into the neck and the jaw and the head and right and throughout these cranial bones, right? It can start to shift your skull even. They're seeing very so slightly. It can add this cranial pressure because of how the fascia wraps right over your head, right, in multiple planes. And so you have multiple anatomy, or you have multiple trains of fascial tension that run throughout your body. And so that's why you want to release them. And so now we're going to get into those releases. How can we start releasing our body naturally? So that was the activation. Now, how can we release these tight muscles that are actually holding us there? Because maybe your body cramped in the middle of your, or the bottom of your feet, or maybe you feel it in your back, or maybe you feel it in your adductors. How can we start to kind of disengage those muscles so that way we can release them and activate them again in the proper manner? And so for the first thing that we're going to do is we're actually going to do a hanging, right? And so a lot of people, when they do hanging, they kind of disengage their entire body. That is not exactly how you wanted to do it. And so I'm going to break that down for you right now. All right, so this is why there's such a big difference between stretching a muscle and releasing a muscle. When you stretch a muscle, it reduces the force potential of that muscle because you're making it harder for that tissue to contract. When you release a muscle, you're saying that there's a tight tissue adhesion or a fascial adhesion that is adhering those muscles together. Now you're saying that the muscles are stuck maybe at a myofibril level, right? The muscular tissue is adhered together because they've been activating similarly on a same path that they're not supposed to because of the exercises or the pattern that you've been holding yourself in. Or maybe it's a fascial adhesion, right? And you're saying the connective tissue is adhered together because of maybe sometimes the way we've been sleeping and things of that nature. It's holding the tissue together and you want to release it. And so the way that you release the muscle is actually more subconscious than it is conscious. And so that's why breathing is critical, is because breathing is a subconscious activation. You're not consciously breathing other than right now for this activation exercise. When you're hanging, is that you want, when you're holding this bar, you actually want to keep your back engaged. Take that deep breath. Maybe you put one leg back and you'll feel a stretch on the other side hip. So if my left leg is back, I'm feeling the stretch in that left leg hip. Taking that deep breath, pulling my belly button towards the spine, and I'll feel my back start to activate. I'll feel my ribs start to relax. Maybe you drop both legs back. Take that deep breath. So you don't want to disengage all the way. What you want, keep that back engaged. Let those ribs expand. Pull that belly button towards the spine. Maybe you bring both your legs up. And so now we're going to get into some of these releases. And so the first thing that you want to do is you want to, utilizing any kind of ball that you have, softness level matters to how sensitive your stomach may be. And so this ball is pretty soft. It's just not pretty soft, but it's relatively soft for me. I've been doing this for some time, so it doesn't bother me. But you want to choose a ball for your softness. They have balls of variable tension that you can look up on Amazon. I'll put some links below for a ball that you can use, not affiliated. And so you want to just grab the ball, you put it down, and depending on the size of the ball, you just want to make sure you're not, obviously you want to make sure you're not on your ribs and you're not on those 12th and 11th ribs, those floater ribs that are on the side. If you have a big ball, you're just going to take it and you're going to lay right on top of it. I like the bigger ball because it makes sure my back is straight. Typically, if you have a smaller ball, your hips will curve under it into that one spot. But for this one, you want it to be fairly generalized, right in the middle. Just want to be right underneath the ribs. And you're going to take your deep breaths. As you get into this position, as you're starting to feel your stomach start to relax, what you'll realize is now you're going to feel the tension of your abdominals. And typically we don't feel that. We feel maybe tension in our biceps, tension in our shoulders, but rarely do we ever feel the tension in our abdominals from just, and especially in our upper abdominals, from being slunched over in a poor posture for a very long period of time. And so unless we release these upper abdominals, it's going to be hard to even pull our shoulders back. And that's why it feels unnatural to pull our shoulders back, because we have this tension in our upper abdominals, tension in our chest. And so we're going to release the upper abdominals. You might have to be here for anywhere from 3 to 10 minutes, depending on how uncomfortable or how you have to breathe through it and how comfortable you are with having a ball kind of basically massage your stomach. And so if the smaller ball or if the bigger ball is too much for you, you can pretty much grab something of any small size, not the handle, but you'll use the smaller part of a kettlebell and you'll line it up with one side of your stomach, right above the hip, right above the hip. So if your hip is right here, you'll be right above it. And you can feel for your own tender spot, right? You'll find a spot that, oh, okay, that's some muscle, that's some tension there, that's some tissue there. And be gentle and courteous with yourself as you're trying to release the tension. And so you're gonna hold it, allow the muscle to kind of relax. And so breathing is also a nervous system reset, which is why you wanna start with breathing first, is because breathing is what's actually going to help your body reset neurologically in order to assimilate the new pattern, right? Because if you're in this position and you're slunched over at work, what's actually happening is your body is remembering it. It's remembering this pattern and it's saying, oh, okay, this is what's natural. This is what's good. This is what I want. And so in order to unravel that, you have to reset subconsciously a new pattern. And so and the best and easiest way to tap into the subconscious is with your breath, because your body remembers through breathing. And so by stimulating your breathing in this new posture, in this new pattern, what you're doing is you're saying, oh, okay, this to your body, this is the new way to hold myself. This is the new way to orient myself in space. And so that's what you want to do for any other myofascial release. So sometimes you do a myofascial release for the legs or something like that. You want to make sure that, okay, you're breathing into this. You want to make sure, okay, my diaphragm is expanding. You're feeling the tissue, right? You don't want to run away from it. If you're running away, you're finding that it's too much, maybe soften the ball, or maybe soften the ball, or start in an area that's easier for you. And allow that muscle to release. And so you'll release the upper abdominals. If you have the bigger ball, it'll probably release most of your abdominals just in general, or your abdominal area in general. So that'll be external obliques. Maybe a little bit of internal obliques might release depending on how big the ball is. And so that is the breakdown to actually how to heal your posture with breathing. I look forward to seeing you in the next video. All right, if you liked that video and you would like to see more, please subscribe down below and let me know what stood out, what areas helped. And if you want to see more videos to eradicate chronic pain, you can join our 14-day muscle rehab, where we just continue to unleash videos to help you eradicate chronic pain. All right, guys, this is your favorite health coach, Nate, signing out, encouraging you to be the hero you want to see.